This is the weekly Health Law News Nugget from Southern Health Lawyers. I'm Rich Sanders.
And this is the Health Law News Nugget for the week of January 20th, 2020. Happy New Year, everybody. For those of you who spent the holidays working hard and getting the new year off to a good start, welcome back to the News Nugget. That's what we've been doing, and why the first News Nugget of the year doesn't come out until after Martin Luther King Day. We plan to get back on track here at Southern Health Lawyers and starting doing the News Nugget on a weekly basis to get more consistent information out regarding the business and politics of healthcare in the United States. And starting off, we have news from this morning that is a radical proposition, or at least seemed a radical proposition, a couple years ago when Senator Bernie Sanders from Vermont, no relation, first introduced the concept of Medicare for all by saying that in his policy proposal and now as part of his campaign for the Democratic nomination for the presidency, that everyone in the United States should have the option to enroll in Medicare, and that obviously the legislative change would entail just making the age of eligibility lower from 65 down in increments of 10. It's a great concept, I suppose, if you're looking for Medicare coverage for everyone. Lots of controversy around it, though, in many respects from the healthcare industry. A, because there are many healthcare providers who are opposed to the way Medicare runs its business currently, a CMS policy, and B, because a program designed for the elderly may not fit, for example, pediatric patients. So lots of controversy swirling over the last couple of years, and in fact, a coalition of healthcare providers formed just to oppose Medicare for all as it gained traction, certainly in Democratic circles. Well, this morning, according to The Hill, which is a newspaper that focuses on developments in politics in Washington, and as the name implies, specifically on Capitol Hill. The Hill reports that the American College of Physicians, the second largest physician group in the United States after the American Medical Association, and primarily comprised of internal medicine physicians, who may in many cases be the primary care providers for their patients, has come out in favor of Medicare for all. This is a departure from the stated policy of the American Medical Association, which along with other healthcare provider groups has opposed Medicare for all. But this morning, statement from the Hill features a couple of different comments from senior leadership at the American College of Physicians, who are basically saying the system is broken, and the United States is the only Western industrialized country in the world without universal access to healthcare coverage. And so something's got to change, and it appears as of this morning that the ACP is on board with Medicare for all. Well, we'll see how that shakes out ultimately. There's going to be a lot of wrangling in Congress this year once the impeachment hearings are concluded, and we'll see how that goes, of course, over the course of January and February. But ultimately, it's going to require legislative change and a president who's promised to veto anything related to Medicare for all to change as well. We'll see. There's always something going on in the world of healthcare law and politics and business. I'm Rich Sanders from Southern Health Lawyers. Thanks for joining, and Happy New Year.